Hello everyone, my name is Mike Blue. I'm president of the Capital District Area Labor Federation. I'm here today to welcome all of you to our annual commemoration of those who have fallen while working. This year's event is unusual due to the coronavirus and the social distancing it requires of us to stay safe. First, I'd like to thank the AFL-CIO, the affiliated unions of the Capital District Area Labor Federation and its staff, the Northeast New York Coalition on Safety and Health, and the New York State Labor Religion Coalition. On April 28th, the unions of the AFL-CIO observed Workers' Memorial Day to remember those who have suffered and died on the job and to renew the fight for safe jobs. This year, we will come together to defend hard-won victories by working people from attacks by those who would seek to dismantle the worker safety programs we've worked so hard to implement. We are committed to fighting until all workers have safe jobs and the freedom to form unions to seek a better future. The Occupational Safety and Health Act and the Mine Safety and Health Act promise workers the right to a safe job. Unions and our allies have fought hard to make that promise a reality, winning protections that have made jobs safer, saved hundreds of thousands of lives, and prevented millions of workplace injuries and illnesses. It's obvious that our fight must continue when looking at the current state of readiness on the part of governments and private entities for a situation like the current pandemic. Never again should we face a situation in which millions of workers are at risk due to poor disaster planning and without proper protective equipment. It is imperative that the government agencies responsible for the health and safety of our fellow workers help to enact and enforce rules and regulations that will ensure the future health and safety of workers is not left to chance. It is obvious that we must hold these memorial observances every year to remind ourselves of the importance of continuing to fight, because our work is not done. Please stay with us now as we look at some of the struggles currently being waged by our fellow workers across New York.
Rosanna Cotabatres, and I'm the director of the Northeast New York Coalition for Occupational Safety and Health. Every year, more than 5,000 workers die on the job from an immediate traumatic incident. Another 60,000 to 70,000 workers are killed by an illness following a workplace exposure to toxic substances. This year, Workers' Memorial Day carries a special significance as we follow the struggle of all workers who risk exposure to the coronavirus so that we may have food, medicine, and care for our family members. The U.S. has seen a pandemic in the past, not in our lifetimes, but in those of our grandparents and great-grandparents. When the 1918 pandemic swept this nation, there were little to no worker protections that ensured those on the front lines stayed healthy. Now, a century later, holding employers responsible for the safety and health of their workers is a given. This year also marks the 50th anniversary of the Occupational Safety and Health Act, the law that created the Occupational Safety and Health Administration. We know how to keep workers safe. OSHA standards provide specific guidance for employers to how to protect their workers from known hazards. Protecting workers who request inspections and report workplace abuses ensures that employers who don't comply with the law are held accountable. And guaranteeing access to training and information empowers workers to advocate for themselves. Now, as we remember all those who lost their lives on the job in 2019, and the many who have already since passed due to workplace exposure to the coronavirus, we must not forget to keep fighting for the protections all workers deserve.
None of us could have imagined that this year we would be commemorating Workers' Memorial Day by participating in a video. A pandemic around us that precludes us from meeting together in our usual supportive community gatherings. But we can't stop our work. The latest data shows that there were 5,250 work-related fatalities in the United States in 2018. That's the highest number in a decade. In New York State, family, pets, friends, co-workers, and communities mourned the loss of 270 workers, some suddenly, some after suffering long, painful disabilities. The deaths were all preventable. These numbers don't even include the deaths from occupational diseases and illnesses, such as 9/11 first responder cancers. Out of the 271 deaths in New York State, 10% were women, 13% were government workers, and out of this group, 75% were local government employees. About a third were foreign-born. 36% were Black, Latino, or Asian. 1/4 of the workers were over 65, a group with a fatal rate of injury, more than double all other age categories. The most frequent type of fatal event is transportation, not just what we would think of as motor vehicle accidents on roadways and farms, but an increase in death to workers on foot, pedestrians in work zones or work sites, struck by moving vehicles or distracted drivers. This is also the most frequent event that caused deaths to our workers in the Capital District ALF region. Fatal falls from heights, workplace violence, and contact with objects and equipment are other leading events. We continue efforts to eliminate the legacy hazards causing these fatal events, but we're also called on to address emerging challenges as we see an increase in deaths from drug overdose, work-related suicides, and exposures of farmers, landscapers, and other outdoor workers to extreme temperature days. We cannot stop the work. We're only beginning to collect the information on COVID-19 work-related deaths. We want to remember today those who have lost their lives and to thank all those who continue to do vital work at great risk: our healthcare workers, hospital cleaners, first responders, mass transit workers and bus drivers, store clerks, sanitation workers, food plant employees, warehouse workers, and all other essential employees. As we remember those who have died in work-related incidents today, we remember a quote from Gene Rossi. His wife, Christina, was killed last year in Schenectady in a vehicular manslaughter incident as she was struck while delivering newspapers in the early morning hours. He said her life was unexpectedly cut short. You're never prepared for that. There's nothing you can do that will prepare you for that. We acknowledge the tremendous suffering of those left behind in the wake of the tragedies of lives lost at work and lives forever changed. Thank you.
Thanks, Capital District Labor Federation, for having us as part of this forum, and thanks for always having our backs. My name is Mike Fitzsimmons, and ICU RN at the Albany Medical Center, and I'm a member of the New York State Nurses Association, NYSNA. Our area hospitals played an important role in protecting our community during the this recent pandemic. Unfortunately, during this episode, we've had to confront our hospital on providing us with safe working equipment. Everybody in the trade union movement knows that safety on the job is a critical issue. Key equipment for nurses during the pandemic is having access to the N95 respirator mask. Our hospital and Governor Cuomo would keep saying in press conferences that nurses have adequate equipment. But until this past Monday, I had one N95 mask for a 12-hour shift, and in many cases we're being told that we can't even use an N95 in situations where we think we should have it on. Through NYSNA's work and support of the labor movement in the area, contacting government officials, we had a press conference. N95s now we have more access to the N95s while we work, which is a big accomplishment. The N95 is essential for us to do our job safely. We want to be able to protect ourselves. We want to be able to protect our families, our other patients, and we want to be able to protect our community. We don't want to be vectors going into our community with possibly having the virus. And we know it's a key issue. We've had over 1,000 healthcare workers around the world die from the COVID-19, and we've had up to 8 of our RNs die in New York City over the last 6 weeks. So this is a key issue for us. Thanks for your help in getting us have more access to the equipment that we need. I also want to send a thanks to everyone who's done quarantining, those who've done sent masks to the hospitals or made masks. And I also want to thank the restaurants and individuals who've sent us food while that we've been able to have for lunch, the lunches that we usually don't even get. But that this has been a big act of solidarity and has helped us a lot. Stay healthy.
I am Billy Gainey. I'm a letter carrier in Ilion, New York. Today we observe the 49th observance of Workers' Memorial Day, a day that stands to remind us that those who have been injured, become ill, and died as a result of going to work to support themselves and their families. This year we face a risk to our safety, health, and life as our nation and world fight an unseen and not yet fully understood enemy. As letter carriers for the United States Postal Service, we must continue working during this national disaster as we do for all other disasters. Our presence in every community provides a calming and reassuring message to our citizens that we will go on. The USPS is also a trusted presence in neighborhoods across the country, especially for the elderly and the disabled who value a daily visit and assistance when needed. As in all declared disasters, the United States Postal Service is deemed an essential service. As our fellow citizens are quarantined, laid off, furloughed, or are self-isolating, the letter carriers continue to come to work to perform the mission of the USPS. As letter carriers, bearing the risk of delivering to every home and business at least 6 days a week is stressful for ourselves and our families. As of today, over 8,000 of the 600,000 plus postal employees are under quarantine. There have been over 900 employees confirmed positive for the virus and over 600 more presumed to be positive. While most of these employees have recovered from the virus and returned to work, it saddens me to report that over 30 employees have died from the virus, including 9 city letter carriers. Our hearts go out to all their families, loved ones, friends, and coworkers. The USPS also plays an important role in the U.S. healthcare system by handling 1.2 billion prescription drug shipments a year. That's nearly 4 million every day, 6 days a week. It also delivers hundreds of millions of lab tests and medical supply shipments, from blood testing strips and insulin needles to contact lenses. The Postal Service is and has been a partner with law enforcement and government agencies that deal with natural disasters and other emergencies. In a major public health care crisis like the one we face today, the Postal Service is more important than ever. In late March, the Center for Disease Control and Prevention sent a mailing to every American household to give our citizens the information they need to protect themselves and their loved ones from the COVID-19 virus. The FDA is currently working on a self-testing nasal swab that must, once available, be efficiently delivered to 135 million households across America. As a matter of public health, there is no substitute for the Postal Service's universal delivery network, especially now with the medical needs rising exponentially. The Postal Service is also crucial for fighting the pandemic-induced recession. With foot traffic plummeting, small businesses increasingly depend on package deliveries to continue generating revenue and employing workers. Without postal deliveries of orders and checks, many will collapse. Similarly, the USPS is stepping up for large enterprises facing disrupted supply chains, empty stores due to quarantines, and self-isolating consumers. It also offers reliable end-to-end services for these firms, while also providing last-mile delivery for tens of millions of packages. The universal reach of the postal network is invaluable to all Americans, but especially to those in rural, inner city, and suburban areas that would not be served if not for the Postal Service. Postal Service is vital to the functioning of the national government during this crisis, offering affordable, universal means to distribute paperwork for vitally needed small business administration loans, household stimulus checks, tax returns, and decennial census mailings, all which must go forward despite the crisis. Thank you.
Hello, everyone. This is Mike Lyons. I'm the president of the Greater Capital Region Building and Construction Trades Council. I just wanted to say a few words on this day of remembrance, such a somber day that we think and we reflect on all of our lost brothers and sisters over the years, and the folks that are still out there that are working, and we want to just make sure that all working men and women, not only in the capital region, but statewide, nationwide, and worldwide, are given the opportunity to work in the safest of environments. And we work hard at the building trades to ensure that for our members, which is somewhat topical right now, given this crazy moment of time that we're all living in with the COVID-19 pandemic. Very many of our members in the building trades have been deemed essential. Fixing the roads, fixing the bridges, putting up temporary hospitals, building hospital beds, to really just do their best to pitch in and do their part for folks that have been stricken with this horrible virus. Sometimes, the folks working construction and the other ancillary businesses that are associated, that are kind of support systems for construction, maybe aren't the first thing that comes to mind when you think about the front line and the folks that are doing the work that we all see every night. We want to thank, obviously, our friends in healthcare that are doing such an amazing job, working tirelessly around the clock to make sure that everybody is taken care of and as comfortable as possible. But we would like to certainly shine a light on the folks, the men and women that are going to work day in and day out in the construction field, that are putting themselves out there as well. They have families, they have loved ones, but they have also been called to task to make sure that, at least in this area and in New York, that we keep the proverbial lights on, and we can do whatever we can do to make sure that infrastructure is continuing and is been done safely, and that we can be the support for the heroes that are truly on the front lines in the healthcare field. So I just wanted to say a few words, and I really thank everybody for their involvement, and let's just hope that we can get through the rest of 2020 as safely as possible, and we don't have to come back next year with any more bad news than we are dealing with in the current state of affairs. So thank you, everyone, and God bless.
Hi, my name is Kristen Shuda. Today I would like to raise awareness about difficult in my life journey after May 4th, 2016, losing my fiance, Justice Booz, to a wood chipper incident that could have been prevented. I want people to be aware of the dangers of a wood chipper and working with wood chippers without proper training. How life for me and my 3 children have not been the same since May 4th, 2016. This sudden death has affected us mentally and emotionally. We have been seeking counseling since 2016. It's still hard. We miss him a lot. Me and the kids often do things in remembrance of him on his birthday, special occasions. Last week I ran into Tony Watson, the man responsible for this horrific accident, and no sorry or how are you was given, still to this day. Still to this day, Tony Watson uses the same wood chipper he killed my fiance in. Yes, I say killed, because it was an accident that could have been prevented. To all of the other families who grieve as well, you are not alone. As of COVID-19, it has affected me, currently my mental state. I have PTSD. I currently run a small business as a CNA. My current clients have laid me off until further notice. Can you imagine the unemployment? I'm still waiting. This whole situation with COVID-19 and losing Justice Booz has currently mentally, emotionally, financially drained me. My bills continue to come in, but no money. I want to thank every one of you for taking your time to listen to my story. You guys are not alone. We grieve together. And still to this day, I hope we all keep our loved ones' memories afloat. Thank you.
And let us pray. Dear Heavenly Father, we remember those we have lost with great fondness, as they gave so much to this world, as individuals, family members, friends, and co-workers. We ask for strength for their families in this tremendous sadness. For those who have died at work building a better place for the rest of us. The ones who died while constructing our buildings, roadways, hospitals, schools, who were growing our food, or serving the public in so many different ways. The workers who died young, innocent, and victims of avoidable accidents. Father, I pray that you accept them into heaven, where you will dry all their tears, you will take away all their pain, and where there is no more death. Father, for us, may we learn from these losses while honoring the memory of those we have lost, and work towards a safer workplace for all people, to ensure the rights and the dignity of all workers are upheld above all else. Amen. Let us take a moment in silence to remember our fallen sisters and brothers.
Andrew Brazdowski, Daniel O. Mitchell, Roberto Morel Cruz, David Vincent Driscoll, Charlene S. Palmachir, Stephen F. Wingard, Martin D. Baileys Jr., Sister Monica Murphy, Grant W. Weaver, William R. Wiesert, Christina M. Rossi, Elizabeth A. Lamont, Richard Brewer, Abdul Hadi Zamani.
Hi everybody, my name is Mark Emanation and I am the Director of the Capital District Area Labor Federation. I've been participating in Workers' Memorial Days for many years now, and when they read the names of the sisters and brothers who have died that year, I always am very sad. But increasingly in the last few years, I find a different emotion sweeping over me. I get really mad. We live in a country where the corporations put their profits over the needs of people. We live in a country where our work life causes, in many cases, unsafe working conditions that causes the death of the very workers that are doing the work. Not just in so-called accidents, where unsafe conditions cause people to get hurt and in some cases die, but with the stuff we work with that gives us cancer and other diseases that kill us slowly. Makes me really mad because we could do these jobs safe, and it's a human right to have a job that pays for our families, but besides that, it's a human right to have a job that you don't have to worry when you get up in the morning to go to work that you won't come home because of unsafe conditions. We have the right to health and safety on the job. This year, that's more obvious than ever, with the COVID-19 coronavirus ravaging our country and the really weak response in some cases to that virus. We see things like Smithfield out in South Dakota, a plant of 2,000 meat packers and meat cutters, that over 900 have the coronavirus that's now spread out to that community. We see our first responders and our medical personnel not having the equipment that they need, told to use their own personal protective equipment 5 days in a row. Clean it yourself. We see our grocery workers and our farm workers working in unsafe conditions during these time periods. So I think that we all should be mad. Not just sad at this day, but we should be mad as hell. And we should demand from the government and the corporations and jobs we work for health and safety on the job now. Do whatever is necessary to get the equipment to our people that's needed now. We need jobs, and we need safe jobs, and we need them now. And so I want you to act on this Workers' Memorial Day. I want you to call and write and email and text whatever government official you think is important to do. Your senators, your Congress people, your assembly people, your state senate people, the governor, I don't care, the president, the city council member, every single one of them should be working for our health and safety. And you should work with your union sisters and brothers, or if you're not in a union, you should get into a union, because unions have been protecting workers' health and safety for as long as I've been alive and for a lot longer. So today is a day not just to cry, but to get mad and to act. Thank you very much.